Welcome to this presentation of Autism and Co-occurring Psychiatric Disorders. This brief 30-minute presentation was developed by Rebecca Gerard and Dr. Michael Romas from the Developmental Disabilities Institute in an effort to help educate people to this important and critical topic as it relates to children with autism. This presentation has been created as part of a New York State Center of Excellence grant to address the increased complexity of children with an autism spectrum disorder who are living in residential programs across the state. The presentation is essentially an overview of how the presence of mental health and psychiatric disorders, in addition to autism spectrum disorders, creates significant impairments and behavioral challenges that make children more likely to be cared for in a residential setting. Individuals with autism spectrum disorder frequently exhibit symptoms of co-occurring psychiatric disorders. This presents as a set of challenging symptoms and behaviors beyond the diagnosis of an autism spectrum disorder alone, which includes medical and psychiatric diagnoses. Children with both diagnoses are often considered to have complex profiles and can be difficult to treat appropriately.
There are many ways to describe the presence of a psychiatric disorder. You may hear these described as psychiatric conditions, mental health conditions, mental health disorders, or mental illnesses. You'll hear each of these terms in this presentation as they all describe the same thing, a child experiencing symptoms of emotional or mental distress that are not exclusively related to their diagnosis of autism. It is important to consider that autism, like all developmental disabilities, while treatable, does not get cured. Psychiatric disorders and/or mental illnesses are sometimes cured and often go into remission with proper treatment. To understand the complex needs of individuals with both developmental disabilities, including intellectual disabilities, and mental health or psychiatric disorders, it is important to know three basic facts. Research has consistently found for more than 30 years that almost all forms of mental health disorders occur more often and are usually more severe in individuals with developmental disabilities. Individuals with developmental disabilities are more vulnerable to abuse or exploitation due to the co-occurring diagnosis and may experience more trauma and post-traumatic stress disorder. And individuals with developmental disabilities often, though not always, experience mental health disorders in a different manner than individuals without developmental delays.
These videos show children displaying what may be described as challenging behaviors. What do you think is happening here? If we were interacting with these children, how would we understand the meaning of their behaviors and what would we consider as potential causes? It is our expectation that as a result of viewing this presentation, you will be able to understand the meaning of the term co-occurring psychiatric conditions and state how it relates to children with autism. Understand the limitations to proper diagnosis and treatment in the field today. Know some of the most common psychiatric conditions and be able to identify when a child may need to be assessed for a mental illness that may be separate from their autism. And finally, we hope to explain how good documentation may contribute to best practice and quality of care when seeking intervention for psychiatric disorders in children with ASD.
Autism spectrum disorder, or ASD, and autism are both general terms for a group of complex disorders of brain development. These disorders are characterized by varying degrees of difficulty in social interaction, verbal and nonverbal communication, and repetitive behaviors. These include stereotypic movements such as hand flapping, rocking, or spinning, for examples. Repetitive or restrictive behaviors also include strict adherence to schedules and routines, as well as restricted interests or insistence on sameness. Some clinicians and caregivers describe this as a kind of rigidity. Autism is considered a spectrum disorder because there's enormous variation in intensity and severity of symptoms that fall along a continuum. The image you see represents that continuum as it relates to amount of supports a child needs to function independently and complete activities of daily life. The more impacted the individual is by their autism, the more supports they will require. No two children will experience autism in the same way or experience the same level of functionality or impairments across their lifespans. Each child is unique.
Autism also affects sensory processing systems. This often creates over- or under-aroused sensory experiences, such as touch, sound, smell, taste, and visual information in a person's environment. Often people with autism struggle to self-regulate. Self-regulation refers to a person's ability to manage the amount of information that they are receiving internally as well as externally. Problems with self-regulation can cause a child to feel overwhelmed often. One of the real hallmarks of autism is the presence of social and communication impairments, or an inability to interact with others effectively and formulate meaningful relationships over time. According to the Center for Disease Control, approximately 1 in every 68 children is diagnosed with autism every year. A child can have two separate diagnoses at the same time: autism, which is a developmental disorder, and a mental health or psychiatric disorder such as anxiety, depression, or attention deficit disorder. Differential diagnosis is being able to tell the difference between what behaviors or functional impairments are attributed to autism and what could be part of a mental health disorder. Differential diagnosis is often challenging for even the most experienced clinicians. It is not uncommon to see children with ASD who also display symptoms of anxiety, depression, or emerging psychoses. The real challenges are, first, figuring out what symptoms can be attributed to which disorder. Is it autism? Is it a mental health or psychiatric disorder? Or is it both? Then we determine the best treatment strategies. How we treat symptoms will be related to our understanding of mental health disorders, specifically in children with autism, particularly if there are significant social and language impairments. These impairments can make the expression of emotional experience difficult. If a child is unable to tell you what's going on and how they're feeling, it is much more challenging to be certain about what is going on and how best to respond. Why is this information important to know? First and foremost, it is important because so many children with autism are affected. Until recently, the number of children with autism who are faced with a challenge of psychiatric disorders has been underestimated. Psychiatric disorders co-occur at an increased rate in children with ASD and ID, but are at risk for mis- or underdiagnosis if symptoms are presumed to be part of ASD or ID. Up to 70% of individuals with ASD have a co-occurring psychiatric disorder. Emotional and behavioral challenges are often the primary reason for children with ASD to present for treatment in all settings and are highly predictive of caregiver stress.
Children with ASD are 6 times more likely to be psychiatrically hospitalized than children without ASD. According to the best, most current study available, up to 70% of all children with autism can be expected to have a psychiatric condition. 41% will be diagnosed with one, 29% will be diagnosed with 2 or more psychiatric disorders. This leaves just 30% with an exclusive diagnosis of ASD. This data was collected from 112 children, ages 10 to 14, with children from across the spectrum, not just children with cognitive challenges. This data still remains the most current information regarding the prevalence of psychiatric disorders in children with autism. The issue of complexity is important as it relates to the quality of a child's treatment, education, and ultimately quality of life. Children with complex needs are capable of learning new skills, including coping skills. However, they often find themselves in situations where either they do not understand or are misunderstood. The result for many children with complex needs is the expression of stress and anxiety in significant behavioral ways. Yes, many challenging behaviors may be the result of a developmental disability and inability to adequately deal with stress, but it remains critical that we are able to recognize and diagnose possible mental health conditions should they occur. It is important to know the difference and apply the proper treatment to the correct diagnosis.
The image here represents the overlapping disorders we've been discussing. We are optimistic that with continued research, the many children who fall into this area of complexity will be accurately represented. As a result, we can expect better treatment and the ability to live more freely in residential settings, or even remain in the community. This chart illustrates various psychiatric disorders by type. You'll see the most common co-occurring mental health or psychiatric conditions are the anxiety disorders, followed by attention deficit disorder. As you see, the anxiety disorders are subdivided by type and by prevalence. You will also notice that oppositional defiance disorder is characterized as a very common co-occurring psychiatric disorder. It is important to recognize that some of the behaviors of children with autism and co-occurring psychiatric conditions can look like oppositional defiance disorder. This is due to accompanying self-injurious and aggressive behaviors, which may be made worse by lack of language skills and an inability to communicate distress in other ways. Here again, clinicians and treatment providers must be careful about making assumptions about the cause and functions of these kinds of symptoms. Also, note that for thought and psychotic disorders, the prevalence here is indicated as rare. This is likely due to lack of data. Fortunately, researchers are actively engaged in exploring this issue currently, and we can expect more accurate information in the future. This slide illustrates the real challenges for individuals with autism across their lifespan. Children with autism are at an increased risk for a number of medical and psychiatric conditions. As you see here, most especially anxiety and depression. This slide is particularly important as it reflects a likely correlation between physical and cognitive or psychiatric illnesses. If not treated adequately in childhood, there is inevitably a greater likelihood that these disorders will present and potentially become more serious in adulthood.
The Diagnostic Statistical Manual, or DSM, is the official manual that mental health professionals use to diagnose mental health disorders. The National Association for Dual Diagnosis, or NADD, has published a number of resources to address the need for specialized mental health diagnosis for individuals with developmental and intellectual disabilities. These include the Diagnostic Manual for Intellectual Disabilities, or DMID. This manual attempts to translate the mental health symptoms outlined by the DSM to better reflect what they might look like in individuals with intellectual or developmental disabilities. Individuals with intellectual and developmental disabilities are more likely to experience severe mental health symptoms and are perhaps more sensitive to some of the negative consequences of mental health disorders. Individuals with little or no verbal capacity may express symptoms of mental illness as self-harm, destruction of property, or other behavioral outbursts. The information presented here is intended to offer an overview of many common mental health disorders. It does not equip participants to diagnose. Specific diagnosis requires the clinical evaluation of a psychiatrist, psychologist, or other credentialed professional.
The concept of diagnostic overshadowing refers to missing the presence of a mental illness in an individual with autism by attributing any and all symptoms as being the result of that one disorder. There are different forms of diagnostic overshadowing that can make recognizing mental illness in a child with autism challenging. For instance,
behavioral overshadowing is the tendency to ascribe challenging behavior to learning or recent changes in the environment. This can result in a bias towards behavioral treatments. For example, if a child has a new teacher, people may assume that a sudden increase in the child's challenging behaviors may be due to this change alone.
medical overshadowing is the tendency to ascribe challenging behavior to concurrent medical conditions. For example, if a child has a history of low blood sugar and is sleeping too much, adults may assume that the tiredness is explained by the child experiencing low blood sugar rather than, say, depression or low mood.
And cultural overshadowing is the tendency to over or under-ascribe challenging behavior and or learning difficulties to some presumed fact or understanding about that child's culture or heritage. For example, we know there are vast cultural differences in the ways families interact. Some families may be characterized as warm or cold. If providers attribute or discount a child's social withdrawal as being in some way consistent with their assumption or knowledge of how that family interacts, They may be at risk for discounting co-occurring psychiatric symptoms such as depression, trauma, or grief. Keep in mind, at times providers will be able to attribute symptoms to changes in the environment, learned behavior, or a co-occurring medical condition. Providers simply need to be aware and able to respond to all possibilities. Mental health workers often use the term baseline to describe what is typical or can be expected in a child's day-to-day functioning. In general populations, a person's friends and family often notice changes in their loved one's baseline functioning as the first sign of mental illness. This includes changes in biological functions such as sleep, appetite, and the ability to take care of various physical needs. Changes may also include the way people interact with others and their ability to go to work or complete other tasks of daily living. First and foremost, a thorough knowledge of a child can be the single most important element in differentiating symptoms. For a child with autism, he or she may exhibit a number of baseline behaviors every day. Some of these behaviors may become more intense or severe when they are experiencing symptoms of mental illness. This is called baseline exaggeration, an increase in baseline behaviors which can occur during an episode of mental illness. For a child with autism, his or her baseline may include certain behaviors such as hand biting, hand flapping, rocking, head shaking, etc., that they live with because it poses no significant impact to their daily functioning or safety. It's when their baseline behaviors suddenly increase in the frequency or severity that we should consider the possible presence of a co-occurring psychiatric disorder, along with many other potential contributing factors. As you can see here, a child may always present with low-impact hand biting as a baseline, but if he or she suddenly starts biting more or harder, and you notice more angry or upset affect, it could indicate a meaningful change to be explored and could have implications for treatment.
Presentation of psychiatric symptoms can take many forms. Importantly, we are always looking at changes from a child's baseline functioning. These changes can be in any direction from what is the norm for a particular child. There are 5 areas in which these changes may be apparent. Biological changes might include changes in sleep patterns, increased or decreased appetite, changes in levels of energy or arousal, changes in expression of sexuality or sexual drive. Even changes in breathing patterns can signal the occurrence of a mental health disturbance.
Cognitive changes could include impaired memory and/or processing difficulties, as well as problems in orientation to time and space. Decision-making abilities, interests, and executive functioning can also be signals of mental illness.
Social changes might include changes in a child's interest and ability to socialize or interact with others. This could be seen as a sudden increase or decrease in social behavior. Such changes may indicate the presence of a mood disorder, such as depression or mania, or perhaps trauma or grief.
Changes in affect or emotion are important. They may be the first expressions of a child in distress. Such changes may appear as crying, inappropriate laughing, rapid and frequent variation in affect, or lack of affect altogether, and/or extreme responses to events in the child's life.
Behavioral symptomology is a difficult category to discuss briefly, given how much we rely on behavioral data to assess and understand this population. Behavioral data is the observable evidence of what may or may not be going on in a child's inner emotional life. There is such a wide array of behavioral symptomology which include, but are not limited to, aggression, assault and self-injury, vocalizations, stereotypy, misdirected sexual behavior, skin picking, etc. Applied behavioral analysis, or ABA, is built around the idea that all behavior serves a function. When dealing with the complexity of mental illness, we must consider more than the communicative function of the behavior. We must recognize that many of the same behaviors are also the symptoms of possible pathology or illness.
The presence of symptoms can negatively impact a child's basic self-care, biological functions, and also learning, the ability to make and keep friends, and the ability to access the community, things that all children need and deserve to thrive.
The presence of symptoms can also negatively impact the environment. Children may be at higher risk for distracting, disruptive, and destructive behaviors. These may contribute to the need for higher levels of care.
It's important to remember that the presence of challenging behaviors are not linked only to autism. In fact, many children with autism do not exhibit challenging behaviors.
In summary, there is an overlap in the symptoms of what could be considered complex or challenging behaviors. The same symptoms can be associated with either a developmental disability, a mental illness, or both. Try to avoid overshadowing or the explaining away of challenging behaviors as merely a characteristic of autism or a reaction to something happening in the environment. People working with children who are displaying such behaviors can look for red flags or changes in baseline functioning for that child, including changes in their normal or expected biological, cognitive, social, emotional, and behavioral functions.
Children with autism living in residential programs are more likely to have a co-occurring mental health disorder that needs separate intervention and care. We want to encourage observe, report, now. Observe what is happening for a child you care for. Report any changes or possible symptoms to the appropriate people, and do so as soon as you notice so there's no delay in treatment. Licensed mental health professionals such as psychiatrists, psychologists, and social workers are trained at determining what symptoms must be present for a mental health diagnosis. The intention of this presentation is to raise awareness of the many red flags that could signal the presence of mental illness that may need additional treatment strategies beyond applied behavioral analysis or behavioral interventions alone. This could, and often does, include the introduction of medications to ease symptoms. When attending an appointment with a psychiatrist or other provider qualified to assess a child, it is helpful to bring any relevant biopsychosocial and behavioral data. Biopsychosocial information includes all of the information about a child on this slide. For example, the demographics, medical history, including allergies, any significant hospitalizations, and any family history of mental illness. Noting any major life changes or other significant life events is also useful and should be discussed. Remember, changes in baseline functioning such as eating, sleeping, self-care, and socialization, as well as any baseline exaggerations of behaviors, should certainly be discussed.
How do we view these videos now? What would make you consider a possible mental health condition? Who would you alert, and what information would you give? We hope you would see yourself as integral to easing the suffering and improving the lives of these children by initiating appropriate assessment and treatment. This presentation is intended as an overview of the subject of autism and co-occurring psychiatric disorders. We encourage everyone to learn more by reaching out to the providers working with a child or visiting the websites for the National Association for Persons with Developmental Disabilities or the New York Interagency Council of Developmental Disabilities.
And a very special thanks to all who contributed to this work.